Question number 4, Scott Simpson.
Thank you, Mr Speaker. My question is to the Minister of Health. Can he confirm that 98% of general practices across New Zealand are offering free visits for under 13-year-olds, covering 770,000 eligible children, or 99% of all under 13s?
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, yes I can. In Budget 2014, the National Government committed $90 million over 3 years for the rollout of free GP visits and prescriptions for children under the age of 13 to complement the existing under 6s policy. The policy has been in place just over 2 months, and the sign-up rate of general practices has exceeded expectation. As at the 1st of September, 966 GP practices out of 985 are offering free daytime GP visits, and we expect that several more will sign up in the coming weeks.
Supplementary, Mr Speaker.
A supplementary question, Scott Simpson.
To the Minister, what are the positive effects of this increased access to primary health care?
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, because the National Government has removed cost as a barrier for young children accessing primary care, parents will be more likely to take their child for treatment before their condition deteriorates. It will also help reduce the number of children presenting at our busy hospital emergency departments with an illness that a GP could have treated. Only a national government can both handle the country's finances and deliver more services.
Supplementary question, the Honourable Annette King.
Is funding for 2 GP visits a year as calculated in the budget going to be sustainable in light of reports that the data used by the Ministry of Health underestimates by 2 visits per child per year nationally for this age group, leading to an annual loss of around $70 to $120?
The Honourable Dr Jonathan Coleman.
As the member knows, during the negotiations with the GPs, all matters were covered, including the rate of uptake and the consultation rate. And I don't know where that report has come from, but I'd like her to present it because, frankly, it doesn't accord with the information we had from the doctors and the information we've had from the Ministry of Health. So I think she's probably making it up yet again.
Point of order, Mr Speaker.
Point of order, the Honourable.
Mr Speaker, that is a constant refrain saying I make things up.
Order.
And that member, I can tell you some of the lies he's told.
The member will resume her seat when I get to my feet. That sort of answer from the final wording from the Honourable Minister is not helpful to the order of the House. I cut order. No, I don't want any response from the Minister. If the Minister wants to stay to answer the next supplementary, I cut the Minister off as soon as he made that comment. I can't do it any quicker than that. But those sorts of answers about members making things up is effectively a reflection on a member, and it leads to disorder, and I will not tolerate it in this House. Further supplementary? Supplementary question, Barbara Stewart.
Thank you, Mr Speaker. Which other political party has advocated for free visits for under 13s? And if it makes so much sense for young people, when will we expect his government to implement New Zealand First's policy of free health checks for super gold card holders? And if not, why not?
The Honourable Dr Jonathan Coleman.
One could only guess, but I suspect it's one that never has a chance of delivering anything.
Question